Bahamas Tonight, the Northern Edition. Good evening all. I'm Shashina Roll. As always, it is so great to have you with us. Topping news, Grand Bahama will reap significant benefits from the Public Hospitals Authority's comprehensive renovation program of clinics across the Bahamas. The initiative includes a combination of upgrades to current health facilities and the construction of a new clinic. Altavi's Munnings reports that it's all part of the government's goal to successfully implement national health insurance.
For the first time, the Rand Memorial Hospital will offer patients a private ward, like the Princess Margaret Hospital in New Providence, in addition to increasing the bed count in public wards. This is just one component of the Public Hospitals Authority's comprehensive renovation program at clinics across Grand Bahama. Prime Minister the Right Honorable Perry Christie revealed even more details at the recent Public Hospitals Authority's Sapphire Ball.
A combination of which has been extensive renovations at the Hawksbill Clinic, offering immediate and material improvement to the quality of life for the more than 4,000 residents of the Hunter Pindus Point, Lewis Yard, Mactown, and Hawksbill areas of Grand Bahama. I'm further advised that the expansion and upgrading of the West End Clinic is currently nearing completion, and I might add that given the authority's track record of execution, we can all look forward to a newly upgraded West End Clinic by October of this year, God willing.
And this new state-of-the-art facility, when completed, will offer a myriad of amenities.
The new improved West End Clinic will allow residents to experience a modern healthcare facility which will offer an expanded footprint, 24-hour service, full access for disabled persons, increased examination and treatment areas, full dental suites, a trauma area, and for the first time, the assignment of an ambulance at the clinic for 24-hour ambulance services to West End, Grand Bahama.
Also on the Christie administration's agenda for Grand Bahama healthcare is the scheduled construction of the Freeport Community Clinic.
This project will break ground in a few months, will meet an important and long-standing gap in the provision of primary care and other outpatient services to those who live within the city limits of our nation's second city. I can assure you, and I have seen the schematic for myself, that is very impressive healthcare facility which spans over 60,000 square feet. And I'm stating for the record that the construction of the new Freeport Community Clinic will act as a down payment on the future development of a brand new public hospital for the Northern Bahamas that will provide secondary and tertiary levels of hospital care for generations to come.
These upgrades for Grand Bahama's health sector complement and support government's goal of implementing its much-anticipated national health insurance program. Altavi's Munnings, ZNS Network News.
Thank you, Alto. Well, new regulations effective as of July 1st for the Bahamas Customs Department is having an effect on couriers. During the Rotary Club of Lacaya's weekly meeting, Assistant Comptroller of Customs explained the new process and what can happen if the rules are not adhered to. A packed room at the Rotary Club of Lacaya's meeting, as Assistant Comptroller Sherrick Martin gave an in-depth presentation on new regulations within the Bahamas Customs Department. He emphasized the fact that couriers are now required to identify who they're importing goods for, as well as what they are bringing into the country.
We say to the couriers, you must list all of the goods on a manifest and the names of those persons whose goods you are importing, and let us know who these people are. Before the vessel arrives or before the aircraft arrives, we want to know who these people are and what they are importing.
Martin explains that couriers must know what is on their bins, and all restricted goods must be approved prior to it being shipped into the country.
They must not allow persons to place on their bins at the last minute items which they do not know, and that they must also make them sign a standing authority saying that the goods belong to them, together with a copy of some identification. We've seen in instances last month where persons were arrested and charged before the courts and probably went on remand because they were trying to clear some illegal goods and they couldn't say who the goods belonged to.
He says the Customs Department is working closely with other relevant authorities, not just in the Bahamas, but internationally as well.
You'll be surprised to know how these people circumvent by their names. Sometimes Interpol asks us certain questions, supply them with certain information. We cannot because of what they do. They change the names. So we say, let us know who Joe Blow is. If this belongs to Joe Blow, then the invoice must say Joe Blow, the manifest must read Joe Blow, and then we can supply this information to Interpol or our other partners, the police and immigration.
He explains that these new regulations should not be criticized, as they are for the protection of the country.
You must know who these people are who are putting things on the bin. You risk your freedom. If you're courier, we don't have no place to go. We must protect this country called the Bahamas.
Now, while there has been some complaints about the new system, Martin says the department recently met with the shipping agents and other stakeholders. About 85% has agreed that the new process is going rather smoothly. Switching gears now, the residents of Pinders Point, Lewis Yard, and the surrounding areas' environmental health assessment is complete. Ricardo Lightborn reports that the monitoring of the community system is also an ongoing matter.
The Pan American Health Organization and the World Health Organization Environmental Health Risk Assessment of the Pinders Point and Lewis Yard settlements and surrounding areas was commissioned in 2014. There has been claims that there is a high incidence of cancer and death of residents in that area. Dr. Marcelo Kroc of PAHO says there is a need for more testing for the area. Dr. Kroc defended a report at the meeting that was called by the Pinders Point and Lewis Yard Pollution Committee with disappointment by residents.
We need to understand what happened with year-round. But we are not only happy with what happened year-round because one year can be different from the next. So that's the reason why we say do at least 3 years of data so you pass from all the different meteorological patterns that you can have. Some years are different than others. Sometimes you have a Niño effect, sometimes you don't. The winds can be in one way, can be another in different years. But if you do 3 years, then you're for sure that you have for all the patterns of continuous data, analyze the data, and then you will know where you're at to really make a very sound evidence-based decision.
There is a safety factor that needs to be addressed, says Dr. Kroc, with the air subject to industrial pollution and chemical emissions and also oil spills.
With regard to the other component is there's no doubt, and you can just see it visually, that the community sits very near the industrial park area. Therefore, if there's no safety risk assessment, a safe risk assessment to really say the safety of the community, not environmental risks, but from the safety point of view, meaning fires, meaning quakes, meaning hurricanes, which effects all those will have in these communities, and there was no really hard evidence to see what can be done, what are the risks for that, and what can be done about it. That was the second recommendation, to complete the health and safety aspect of it.
But you will be getting more information, more data as it becomes
Absolutely.
available. The Minister for Grand Bahama, Dr. Michael Darville, says the ongoing testing will be done. The safety of the residents in the area is a priority.
As we come through the Pinders Point and Lewis Yard, all of us are aware that some of the homes are in too close proximity to the industrial sector. This is the reason why we have to get the right consultancy group in with the global reach in order to do that assessment, particularly in the industrial area, to ensure that the outcome meets the recommended global standards, and that if we find anything that may be inappropriate as it relates to close proximity, the recommendations would be made and the government and our industrial partners will have to respond to it.
Environmental monitoring system will be carried out in the affected areas and recommended strategies to protect the public. Ricardo Lightborn, ZNS Network News.
Well, the murder count rising overnight. No murders occurred for the month of July, but on August 2nd, a man was found stabbed to death. Italia Hall reports.
Police on Grand Bahama are investigating the death of a 46-year-old male of the Drake Avenue area. Reports are that on Tuesday, August 2nd, shortly after 3 a.m., police were called to an apartment complex on Drake Avenue. Inspector Teresita Pinder says both the deceased and the suspect are known to police and explain what officers found on the scene.
Reports were that there were some kind of fighting or an argument happening in the apartment, and officers arrived here, and they met a lifeless body of a male laying face down with multiple stab wounds about the body. EMS personnel came here, and they said that there was no life to the body.
Now, police say there is a 45-year-old male of this area that is assisting them with this investigation.
Officers then, who were the first to arrive, combed the area, got certain information, and as a result of that information, officers were quickly able to arrest a 45-year-old male suspect. Officers apprehended him some distance away from the scene.
This latest homicide brings Grand Bahamas' murder count to 10 for the year. It's Talia Hall, ZNS Network News.
Stay with us. There's more news right after this.